All right, welcome to another Wellness Wednesday. I'm Dr. Stephen Ramos with HealthTexas Medical Group. Every Wednesday we're bringing important topics about healthcare and health in the community. And today I have another repeat guest, Jeremiah, a local manager with United Healthcare, here to talk about what has just passed annual open enrollment for Medicare. So Jeremiah, this past Monday, annual enrollment period ended. And we may have some patients that maybe didn't get that message or didn't get enrolled right away.
Lots going on in 2020,
Yeah.
so it was easy to miss that deadline.
Is there anything those patients can do now that that deadline is passed?
Sure. So annual enrollment period ended Monday, December 7th. So a lot of people ask, what now? Do I still have an option to look at Medicare plans for January 1st before everything changes? And the short answer is yes, especially this year if you live in Bexar County. We actually have a special election period in Bexar County because we were affected earlier this year by some of the hurricanes that hit Texas and Louisiana. We actually have a special election which for all intents and purposes basically extends AEP through December 31st. So if we have patients or people who might be interested in becoming HealthTexas patients who want to learn more about their Medicare plan options, they can actually enroll. They can get information by before December 31st and still start in January. So that's one way. If people have chronic conditions such as diabetes or heart conditions, if they're retiring, if they are if they're newly qualified for Medicaid or just qualifying for Medicare, they can also enroll. So really the important thing is if you're concerned about your Medicare plan, if you're not sure if it starts, if you're all ready to start on January 1st, call in and we'll be happy to help you. There's still a lot of ways out there that you can enroll.
Good. So a lot of important information for our patients. If you happen to have missed that deadline and still have some questions about, do you want to continue with the Medicaid or Medicare plan that you have currently? There's still some options to get enrolled and to change some things. And so going along those lines, if maybe we did have people that listened to us a couple weeks ago and they did change their plans or they got recently enrolled in Medicare, what does January 1st mean? What are some things that they can do to get ready for that new change?
Sure. So even if you didn't change plans, a lot of Medicare plans change on January 1st. A lot of they add some additional benefits. There's new plans, some old plans go away, and so it is important to know what plan you're on to be confident in how it works. And then on January 1st, when your plan starts, a lot of these Medicare Advantage plans include additional benefits like gym memberships, like dental care, like personal emergency response systems. Those are things that you can call the plan and activate. So activate the gym membership, activate the personal emergency response system. But I think the most important thing is make sure you schedule that first appointment with your doctor. Your new plan starting, it's really important to get in front of your new primary care doctor and make sure that you get seen in the start of the year. Let them get to know you.
Yeah, that's really important. Something that I want to relay to anybody who's especially having a change in their health insurance, especially with everything going on. That first visit with your primary care doctor is just really crucial, not only for the patients, but for the doctors. That's the time where we get to learn everything that's going on, learn about medications, learn about active problems that are happening, so we can get started, early in treating them and getting them better, and also utilizing maybe some of the new benefits that they may have. So, for instance, at HealthTexas, we have representatives and agents with all kinds of information about new, access and new benefits to their plan. So, going to that doctor's visit, not only do you get to, potentially meet your new doctor, get some information, but also can maybe learn more about your new benefits as well.
Yeah, there's a lot of new exciting benefits. I mean, when it comes to dental, gym memberships, transportation, just getting you to and from the doctor, there's a lot of help available there at no cost. And so it's very important, to have a plan that provides that whole picture of health, to make sure that you have those benefits that go beyond what Medicare covers, the vision, the personal emergency response system, like we mentioned, to just make sure that you've got you're not missing out on anything that you're entitled to through the Medicare program.
This is wonderful news for us, with a lot of the new benefits that are coming out, a lot of exciting things for my patients. Like you said, transportation is a big one. Medication costs, I think there's going to be some changes there that are going to be great for our patients. So we're very happy that some of our patients have taken advantage of this open enrollment period, made some adjustments, got some more benefits. And again, if you're too late, you missed Monday's deadline, don't worry, there's still options out there for you to get some more benefits on your Medicare plan if you so choose. So please contact us, let us know. And then again, like you said, if you did make those changes, or even if you didn't make changes, make sure you schedule an appointment with your primary care doctor early in the year so that we can get a head start on really getting to know our patients and keeping everybody healthy.
Bring your medications in, make sure it's, you get those refills taken care of, and there's no lapse in being able to get those medications you need.
That's a big one. Bring in, always, anytime you go see your primary care doctor or any physician or healthcare provider, medications, any recent medical records, any updates that you have. If you've been checking your blood pressure at home or checking your weight, checking your blood sugars, bring all that information. It's incredibly useful every single time you go see the doctor. These are great tips for the upcoming January season.
Yeah, January is an exciting time. We've got a lot of new plans out there. We've got plans designed for people with diabetes. We've got plans designed for those who have veterans benefits, and we just don't want people to miss out. There's a lot of new benefits. There's a lot of new exciting things out there. And so if you're not sure what you have, if you're not sure that, if you're worried you might be missing out, give us a call. We'll be happy to help you. There's lots of ways for us to still change your plan before January 1st, and we'll be happy to make sure that you're confident that you're covered going into the new year. Because with everything going on in 2020, it's just important to understand your plan, understand how to maximize the benefits you have, and to know that you're going to have care from your doctors, from that whole network that's there to support you.
So if anybody watching right now, they wanted to reach out and ask those questions, or maybe see what kind of benefits particularly United may have, how can they contact you guys?
Just call the number on the bottom of the screen. We'll be happy to connect you with some local agents who know the plans. They know the doctors, the great doctors in the United Healthcare Network, like the doctors at HealthTexas Medical Group, like yourself. They can get to know you, get connected, get plans that give them access to the great care that HealthTexas is able to provide for them.
Fantastic. Well, I think that's about all the time that we have. I appreciate you guys coming in and watching. Remember, annual enrollment period did end on Monday, but we have options available if you still want to add to your benefits or make any changes to your Medicare coverage. Please give us a call at the number below if you have any questions, or if you want to schedule a visit with any of the HealthTexas physicians. Thank you again, and y'all have a good Wednesday.